Well, thank you for being a part of our video today, which as you know, we're going to do Photoshop versus cosmetic injectables. So it's going to be Photoshop versus virtually, me. Yeah,
Photoshopping me.
Yeah, me. I'll be sort of doing the real life Photoshop. I'll be doing mine with anti-wrinkle injections and some dermal fillers for your whole face. And what we're going to try and achieve is a really natural look. And you said you were 39?
39.
Yep, 39. Very, very youthful for 39. But nonetheless, we're going to try and take that to the next level for you. We're going to compare the effect of these two approaches and see which ones our viewers prefer. And I think with Photoshop, I guess you have the danger possibly of changing your face too much and then making you look like someone else. But I think we've got the edge, because I think we're going to get a more natural result basically with you and try to make you look like the best version of you.
Hi, my name is Gavin Chan. I'm a full-time freelance photographer based in Singapore. Photography has always been a bit of a hobby of mine that sort of expanded over the years. I think Photoshop has the power to really enhance any part of the image. You're only really limited by your own imagination as well as your own skill set. Depending on the jobs that I'm currently working on, my clients would really differ between being very natural or being very dramatic. So I'm currently focusing more on product and beauty, which is a good balance between natural and dramatic elements. So with beauty, there's more of a freedom to experiment. So with any beauty shot, the skin is the main concern, because we get like micro bumps here and there. We have aging spots and warts and pimples. Those are the things that really distract from the final image. So I wouldn't really say it's taking away its natural form, but more of removing the distractions, but always keep it natural.
I really want to look like myself.
Yeah.
Really don't want to look like someone else. Really don't want to look too ducky.
You keep well, and I understand you do a lot of exercise.
I do a lot of exercise, eat well, look after my skin, always wear sun cream.
Great.
And just trying to make myself look a bit fresher.
You know how when you see Photoshop pictures, sometimes the skin doesn't look that natural. I'm not sure how Photoshop works exactly, but they have probably some algorithms in there which, you can get rid of blemishes or, pigmentation, freckles, things like that. But we don't have those sort of things, but we have, I guess we have lasers. And what lasers can do is pick up certain parts of the skin, for example, unwanted pigmentation or blood vessels or redness, and we can sort of extract them out of the skin and sort of specifically target them. But we're going to do some treatments for your skin as well, so we'll try and get a whole package for you, which involves sort of anti-wrinkle injections, fillers, and then looking at skin treatments. And we're going to see whether we can even do better than Photoshop. That's the challenge today. We're going to try, and we're throwing the gauntlet down, and we're going to try and beat Photoshop.
Yes, I believe that I'm confident enough to beat Gavin in this challenge. I think my biggest edge of Gavin is the power to undo. So basically I can fix it, without the downtime of recovery.
It's a bit of a challenge because I can't do everything that Photoshop does. But maybe that's a good thing. Maybe the limitations are such that we can make you look a bit more natural.
A bit more like myself.
A bit more like yourself. In fact, I think I don't really want to make you look Photoshop, so maybe I have an advantage in that way. But there's pros and cons to injectables versus Photoshop. So Amy, are you ready today for your
I think
for your
so.
treatments?
Yeah.
Okay, great. So firstly, I can say that Amy has lovely skin and a really good canvas to work with. Looks very youthful for her age. She looks natural, and she doesn't look like she's been worked on, which is really good. And that's certainly the effect I'm wanting to continue with today. One of the first things we need to assess her forehead or upper third in comparison to her mid third, which includes the eyes and the nose and eye area, and then the lower third. Just use a tape measure and actually measure the length of each third. So here we go. We have from the hairline to the brow 6 centimeters, and theoretically we should get that same length for each other third. So from the hairline to the nose, probably if you go to the tip of the nose, 6.5, and from the nose to the chin, about 6. So pretty good. Overall length of each area is fairly consistent, so that's good balance. So we'll just cover the lower 2/3 of the face, and just look at the forehead. It's actually quite good. It's smooth. Raise your forehead up. It doesn't wrinkle a lot, even with raising your forehead. The volume's not bad. Probably a little bit of volume loss in those areas, laterally on the sides there. But overall, pretty smooth and nice. Nice brows as well. I guess the brows are at the junction of the upper and middle third. Looking at the middle third, beautiful eyes. Definitely a nice feature. Fairly strong third. There's a little bit of volume loss around the eyes. We could also look at the nose as well. Just turn to the side a little bit there. Maybe there's some parts of the nose we could enhance or correct. The lower third of the face, maybe the beginnings of slight fullness in the jawline. But nice, lovely lips. Probably this is an area which we could get a fair bit of difference from. So I would say, in order of strength, you go from top to bottom. You're probably strongest at the top and weakest at the bottom. So we could work a bit more in this area, and that will get you more sort of enhancement of what we can do with the lower face.
I think what makes one attractive really depends on where they're from and what is believed to be attractive in that particular region. And it depends on their influences as well. For example, women in Asia, particularly in Singapore where I'm from, we are very influenced by the Western culture. Traits such as bigger eyes, fairer skin are considered to be attractive. But of course, all these would depend on your ideals and preferences. Where I come from, we are also very influenced by Korean beauty products. So features such as, the subtle dewy skin that you get in the morning is something that, what my makeup artist as well as I try to achieve in Photoshop. It's a very natural sort of beauty in a way.
Another good assessment tool that we can use is the golden calipers. So these are calipers which have a fixed ratio of 1 to 1.618, no matter what angle you put them at. And the reason for that special ratio is that's actually the golden ratio. That ratio is seen in nature, it's seen in beauty, it's seen in famous artworks by Da Vinci. It's actually a very aesthetically pleasing sort of ratio. So we can use this ratio and measure parts of the face and see whether they fit within these ratios. We use a fixed point which doesn't change with aging, and that's the distance between the eyes. And that will always be the same no matter whether she's 80 or 20. With this ratio, we can actually measure other parts of the face and see it should fit into either 1 or 1.618 times the distance of that distance between the eyes, or what we call the intercanthal distance. Firstly, we'll measure the length of the forehead, and you can see it's spot on. So this is a perfect height you have the perfect height forehead. The distance between the eyes should be distance from the middle of the eyebrow to the peak, and it's spot on. Okay, if we look at the full length of the eyebrow, it's 1.618 times the distance between the eyes. So again, spot on. The nose length should be, again, 1.618 times the distance between the eyes. Okay, and the width should be the same distance as between the eyes. So interesting, it's a very simple but important point, that the width of the eyes should be the width of the nose. So the nose length and width are perfect for her face. Now the next part, we assess the length of each area of the face, but also another way what we can do is assess the length of the chin. So according to these calipers, the chin is very short. Sometimes when you get results like that, sometimes you have to use your own aesthetic judgment as well. So possibly we could enhance and lengthen the chin a little bit, but probably not to the extent that these calipers suggest, which is probably another centimetre, which is a bit ridiculous. And the width of the chin should be approximately the width of the eyes, which it is. We'll be interested to see what the Photoshopper does with your chin as well.
First thought on Amy's look, she's got a very interesting set of eyes. Don't think I'll be doing much to that. Most of the work I see are in the skin itself. Lots of warts, aging marks, as well as a lot of redness in the skin. I think it may be due to the sun. So I suppose anyone would want to look a bit younger. So removing all of those would dramatically, make a person look young. So what I plan to do is to fix the aging spots, the redness, and probably reshape a bit of a jawline to make her look a bit younger and perhaps give her a bit more neck. and a slight sunken cheek, with the contour, and to give it a bit more of an edge.
We've assessed the front of the face, we're going to assess the profile. The first thing I do in assessment, I actually get the patient in what we call the anatomical position. We need to assess this line called the Frankfurt horizontal line, which basically what it does is it lines up, and I'll do it from this side, the ear with the inferior part of the orbital rim, which is where the orbital bone would sit at the lowest part of it. So we make sure that line is parallel to the floor. So it's a slightly chin down position, and one of the first things we do is see whether the nose bridge lines up with the chin. So the nose bridge probably is slightly forward of the chin, where according to this assessment we could sort of project her chin forwards a bit. The nose tip from this side is fairly neutral, and the lip possibly could have a bit more of a ski jumpy effect. So that's an important part of the assessment, the profile. We've done some assessment of the proportions, and what we want to do now is assess volume. So Amy's quite a fit individual and does a lot of exercise, so if you keep a slim physique, your face will not be as full naturally. As we get older, one thing we do notice is more volume loss. The forehead should appear to be nice and convex. It's mostly convex, a little bit of mild concavity and just above the brows, which we'll fill for her today. The temples, now they're a little bit concave, should be either maybe slightly less concave or neutral, certainly not convex. The cheeks, actually not bad, you've got good volume in the cheeks. We will enhance it a bit more, just to give you, maybe make you look 22 again. Yeah, give you 22-year-old cheeks. And the other thing is with cheeks, they also support the eye areas. Lips, this is more of a preference thing. Some people will like larger lips and some people will like smaller lips, but I think what we'll try and do is give Amy something which balances with her eyes and nose, and something that looks like she was just born with it. A bit of volume loss around this area here in what we call the pre-jowl sulcus, and filling this area here, mouth corners, pre-jowl sulcus, will actually enhance her jawline and also replace some of the volume. Chin, we can add volume to that for more of enhancement purposes rather than anti-aging purposes. In terms of her nose, she has had previous rhinoplasty before, and what the surgeon say, he slipped there afterwards. There's a slight indent here on the right side of the nose. So that can be filled, but there are actually some risks associated with nose filler that we've talked to Amy about, and this may be something that we don't do today because of the risks of causing blockage of the blood supply. Another thing is around the orbit or the eyes, you often get volume loss, and we often get volume loss or hollows under the eyes, as well as an area which is not filled that often is the brow or the upper part of the orbital rim. So you can see there's a bit of bony appearance just there. The next step is the pre-assessment planning. Very important, helps me visualize what I need to do for Amy, and also the other thing which is really important is actually using this machine called the AccuVein, and actually tracks where all the veins are on the face. If I know where the veins are, I can avoid them with the needles or cannulas, and therefore hopefully get a bruise-free treatment. We'll just mark in the veins with this red eyeliner pencil. Most people have a sort of similar pattern of veins, it's this general areas where the veins will sit. So we've marked the veins on Amy's face, and I'll try my best to avoid these. As you can see, there's quite a lot of veins. We'll be doing most areas of her face. Next, I'll mark out where we're going to place the anti-wrinkle injection. So I'll get you to give me some frowning, Amy. So we're basically injecting through the whole muscle here called the corrugator muscle, and the procerus muscle here, which contracts downwards, gives you the horizontal line, the corrugator muscle, which contracts inward and gives you the legs 11 line. She doesn't have any static lines there, which is good. In other words, at rest there are no wrinkles. The frontalis muscle is a muscle which has two bellies and is attached to just under the brow to the scalp, and it lifts up the brows and gives you forehead wrinkles. This is the orbicularis oculi muscle. Basically, this muscle contracts around the eyeball and gives you radial lines or crow's feet. So you can see this chin pulls up and in. We can relax that down. We don't want the chin pulling up and in, because as we get older, the chin goes up like this and the nose tends to sink down. So we get a very closed angle there. So keep her looking young. We want to pull the chin down with anti-wrinkle injections. If you took a a still picture before and after treatment with anti-wrinkle, there's not much difference. So you only see the difference when you express. So that's one thing that you may not see in the before and afters with this, but we're going to do it for her anyway. And sometimes you get some very subtle differences at rest. I've got yet another colour pencil, and we're going to do the markings for her fillers now. There's a bit of volume loss in the forehead here. You can see just above the brow, it's a bit flat there. Now we'll look around the eyes, look up to the ceiling. Just mark out the areas of the cheek, which I think could do with some volume there. One thing we can do with the cheeks is put a highlight point in. It's usually done by drawing a line between the top of the nasal alar, which is here, and the top of the tragus, which is the part of the ear in the middle there, and then running a line down the middle. Also feel a little bit just around in this hollowing here, and that sort of gives you a very padded, full look to the brow and eyelids. Looking at her nasolabial folds, which are the folds between the nose and the mouth corners, possibly Amy could have just the tiniest bit in the top corner there. Okay, now the other parts of her face that could do with some softening is just here behind, next to the ear. You can see there's a bit of hollowness just behind there. I think filling it in would look nice because it actually give her a nice silhouette to the face. The lower face is important for Amy, and we identified this as probably her weaker area. Putting a bit of volume in the mouth corners in what we call here the pre-jowl sulcus, which links the chin and the jowl or the jawline area. So we're going to try and project the chin forwards and downwards a little bit, fill in the bridge between the jowl and the chin, the pre-jowl sulcus, mouth corners to prop the mouth corners up, and just fill in some hollows around the chin crease area.
So now I'm going to take you through my process of retouching Amy's face. So we start out with the hair. You know, we will need to clean it up a bit before we can actually work on the skin. Clean up the veins, there's quite a bit there. Clear up the neck. A bit of warts and necklines. The vein, clear up the eyebrows, neaten up the nose bridge. Now we'll clear up the forehead. All these are the aging spots that you see, all the brown tones. So what I tried to do is to cover it up a bit. Removing a bit of the wrinkles, more aging spots. Trying to neaten up the eye bags a bit. Fix a bit of the lips, it looks a bit cracked. Now what I'm doing right here is I targeted the redness in the skin, and I'm just lightening the spots on her face. As you can see, her face is quite spotty. So I'm basically just evening out the skin tone at the moment. Trying to remove all the bumps as you see. There's a lot of work that goes into finalizing an image. Working on the neck, giving her a bit more defined. Now what I'm doing here is to color correct the neck because the neck is a bit different. So this is contouring. I'm just contouring her face, giving it a bit of a airbrush finish, enhance the neck, give her a bit of a lip, fuller lip, making it a bit more symmetrical. And then brighten her eyes as well. Now I'm just texturizing her skin slightly, giving her a bit more definition.
So the first step is just to numb the face. So this is all the anaesthetic going in. This is where the cannula will go in. So cannulas are blunt, and you need to put a little needle in first. So you just numb the skin where the needles will go in, and then we can insert the cannula through the hole that the needle made. We use ice and vibration to help reduce pain. What I'm about to do is supraorbital and supratrochlear anaesthetic, which basically numbs from the brow to the middle of the scalp. Now a local anaesthetic with no adrenaline, which means essentially it'll only last for half an hour or so. I've anaesthetized the areas we're treating today, and now the next step is to put a little needle hole into the insertion points where the cannula go, which is blunt. So this just makes an entry point for the cannula, and no blood is always a good sign. So the first part is we're going to do the forehead filling. It's a very easy area to make lumpy, the forehead, so it's important that the filler selection is correct. So I'm going to inject the upper inner eyelid and this will sort of give her a nice contour across the whole brow. It's a very unusual sensation for the patient. So I'm going to inject the temples now. We use a special technique which only involves one injection very deep down onto the bone. Now, the reason for this is twofold. Firstly, the bone area which doesn't have any blood vessels on it, so it's very important that we miss the blood vessels there, because these blood vessels do supply the eye. So it is actually possible to go blind from doing these treatments. So I don't want to scare you, but it's a very, very unusual risk, and with this technique the risk is sort of minimized to a very, very, very small extent. The other reason is on the bone, the filler actually sheets down the bone because the temporalis muscles attach the bone, and basically what happens is that it sort of is a tight space, so the filler can only go down. So one spot injected up here will fill the whole temple. Now we're going to do the cheeks, and we're going to try and get some forward projection as well as some of the improvement in the highlight, that highlight point there. Filling the mid-cheek in many people often helps under eye hollows as well. It supports the under eye area, and you get some improvement with the appearance of under eye bags. Now we've done the cheeks, and now I'm going to use a very, very fine filler which is actually designed for the eye area. In the past we haven't been able to do this as well because we haven't had these sort of fillers, but this one is actually amazing, this filler, because it actually attracts less water, and what you see is more of what you get. You can just see it blend in with the cheek as I'm injecting there. Yeah, this is definitely a trick that you'd use on Photoshop.
So with this second image, what we're going to do is we're going to remove all the distractions once again, all the hairs that are cutting across the face, you know, all the imperfections. We want to work with a clean plate on the skin. So removing all the aging marks as well, trying to neaten it up, trying to balance the colors, because there's a lot of browns that are in the skin that, you know, really ages her. So trying to remove some of the brown, but at the same time keep it as natural as possible. Right here we're removing all the imperfections in the neck lines, the aging spots as well. Neatening up her lip, her jaw. Still lots of spots. Remove the wart. So right here we're gonna lighten up the sort of imperfections in the skin. There's a lot of bumps, so we're going to lighten the bumps so it kind of has a gradual transition between the more smooth part of the skin and the more indented part of the skin. So removing all the shadow areas, kind of lightening her eye bags and her nose a bit. You know, same thing with the chin, same thing with the jaw. Giving her a more defined neck. So I've readjusted the redness in the skin as well. Give her a bit of a contour. Reshape the neck, reshape the jawline, and giving her skin a bit more texture and brightening her eyes.
Going to do the lips now, making a little entry point for the upper lip. I'm going to be using a cannula. The advantage of a cannula is that I can weave through the lips and avoid blood vessels to get her a really nice shape, probably slightly more centrally focused. There will be definitely some swelling with the lip filler. Okay, now we're going to do an interesting enhancement. Basically, we're going to enhance the philtral columns. So these two philtral columns are the lines that run from the nose, middle of the nose, to the lip, and give the upper lip a nice curly sort of look. Angelina Jolie has very nice philtral columns if you look at hers. We're going to make sure that we get the right shape. But look at that instant lift in that column. So it's going to do a bit of mouth corner filling here, just to lift the corners of the mouth. So you can actually see the mouth corner turning up a little bit as I inject the filler. We're going to entreat the preauricular hollowing. So this is part of the silhouette of the face, and that's just the area under the cheek there. I think this makes the filler that we put up here in the cheek look more natural, just blends it in a bit more. We've gone from the top, now we're finally down to the bottom part, which is the bit we need to enhance the most. So we're really going to get that jawline a lot stronger for you. First part we'll do is the bridge between the jowl area and the chin. So it's called the pre-jowl sulcus. And we'll fill just along front surface here, as well as going a little bit underneath to lower this part of the chin so it all matches up. Now we've got to be very careful when filling this area not to actually put any volume in the jowl itself. We're going to inject the chin now. That looks quite nice. I think that looks beautiful. So the chin and nose, they're all perfectly aligned now. Bit of anti-wrinkle injection now. Sting. We're targeting here the corrugator muscle and the procerus muscle, which contract the frown.
So basically I fixed the more prominent flaws in the skin, like the redness as well as the aging marks. But I kept her natural sort of beauty marks that are on her skin. I try to keep things as natural looking as possible when trying to re-age her. So I lifted her cheeks, gave her a bit of a lightened eye bags, you know, because without eye bags we look a bit unnatural, so I tried to lighten it just a bit. You know, you don't want to make her look like a porcelain doll.
When I look at the skin on the Photoshop version of Amy, I can see there's been a lot of removal of basically every imperfection. Whereas we did one treatment, which was the Fraxel laser, to mainly address the pigmentation and freckling of her skin. The laser basically took a layer of skin off, removed any sun damage or freckling that sat within that layer, and new collagen and new skin came out. We could have gone on to do further lasering, including vascular laser or some removal of lumps and bumps, for example. In this case, we decided not to do it, despite having about a 7-day recovery time, as opposed to Photoshop, which was an instantaneous result. I think her skin looks really nice and natural. It doesn't look too porcelain, and it doesn't look like it's been overdone. She just looks like she's really healthy and well.
Well, I believe that manipulating someone's image digitally is somewhat safer, as well as, you know, it may actually be better and cost effective in the long run if you think about it. You know, with Photoshop, you can undo at any point in time, you can rework it, you know, bit of a hassle, but I think it's well worth, you know, your help. I believe that cosmetic surgery has its place, as long as it's used for the purposes of making someone's life beneficial. If it helps someone with their confidence, sure, why not? If it's for superficial reasons, I would rather you go digital, you know, because these are things that, you know, you can always rework, redo.
Wow, I can really look like that, but it doesn't look like me anymore. I thought that they were pretty unnatural, but interesting to see what I'd look like if I was on the cover of something. But I did think that that's not a natural way that people walk around and look.
Do you think your friends would recognise you like that?
No, I don't recognise me. It's changed so that I have no structure to my face, very flat.
In terms of safety, obviously with cosmetic procedures there's going to be a degree of risk. It needs to be done, in this case with fillers and anti-wrinkle injections, they need to be done periodically, so it's not just one treatment forever, but in a way that's good, because as she ages we can tailor the treatments to whatever she needs. Photoshop obviously has no downtime and no recovery, and it's instantaneous, but you know, the real life effect on you every day is something really powerful, and something that really boosts the self-esteem of our patients, and you know, really gives them a confidence booster. Okay, so this is your picture, straight from the camera.
Oh, love it. I think I look younger and fresher and real and like a person, and like I wanted to. Different to Photoshop. Photoshop I looked very fake, and this one I just look like a cleaner, newer version of what I was.
I was really pleased with the results from Amy's treatment. I think in real life we had the edge over Photoshop. Although I think with Photoshop there was way more flexibility and breadth of what you could do. Those limitations actually kept us within natural bounds as well. So the differences probably weren't as dramatic, but I think because of that it actually looked better, and I think Amy got a lot of compliments on her appearance because of the naturalness of the result, and the fact that you couldn't really tell exactly what had happened.
So I'm finding people are commenting that, wow, you look really different, or what have you done? You look like you're really fresh or younger, or a lot less. Are you tired? Comments from people. Positive comments that people can't quite work out what's changed.
On this front, I think we got as dramatic a result as the Photoshop in terms of contouring and shape changes, but enough so that Amy looks really refreshed, and you can see in her after shot and video that she looks really nice and natural, and there's something about her that looks really good.